Playing football can be a great way to build your body. It works your muscles, increases your lung power. It can even strengthen your heart. Still, all sports contain an element of risk, none more alarming than sudden cardiac arrest. Hi, I'm Dr. Max Gomez, and this is CONCACAF's Winner's Health, your football source for keeping players healthy and in the game. Sudden cardiac arrest is a condition in which the heart suddenly and unexpectedly becomes short-circuited. A victim will almost immediately lose consciousness as the heart stops pumping oxygen to the brain. Death can result in a matter of minutes if the heart is not quickly resuscitated. While sudden cardiac arrest is extremely rare in football, I'll say it again, extremely rare, it's an important topic. First, because it can be fatal. Second, because effective preventative measures can be taken. And third, because there's so much fear and misunderstanding about it. So let's set the record straight on football and SCA, or sudden cardiac arrest. It's the middle of a football match, and the player has no idea that he or she has any kind of heart problem. Suddenly, the player feels a little bit faint and immediately drops unconscious to the ground. Later, doctors will diagnose the player with sudden cardiac arrest, or the unexpected stopping of his heart. So what happened? To understand what can seem like a bolt from out of the blue, we first need to understand something about the heart. The heart is a beating muscle whose purpose is to pump your blood, the blood which carries oxygen and nutrients to every cell of your body. Each heartbeat represents a single pumping action. So it makes sense that the heart gets quite a workout. In a day, the average heart will beat 100,000 times. What powers all of this pumping, believe it or not, is electricity. Because the heart has its own built-in pacemaker located in the upper chamber or atrium of the heart. This pacemaker generates electrical impulses, kind of like a spark plug causing the heart to beat. Its job is also to regulate the rhythm of your heartbeat. This is very important because if the rhythm goes off, speeds up, slows down, becomes erratic, the heart stops pumping efficiently. It may even completely shut down. And that's essentially what happened. The player's heartbeat went out of rhythm and then stopped. No heartbeat, no blood flow. No blood flow, no oxygen carried by the blood to the brain. With the brain deprived of critical oxygen, the player passed out. Of course, nothing in the body is ever really that simple, and a very big question remains. What caused the heartbeat to go out of rhythm in the first place?
Sudden cardiac arrest is not a problem that comes out of the blue. It always has a reason. And the reason may be a problem of the heart muscle, it could be a problem of the valves, or a problem of the electrical system of the heart. In older athletes, we think of blockages of the coronary arteries as the main reason.
The player's cardiac arrest didn't come from nowhere. He or she had some hidden heart condition of which he or she wasn't aware. It might have even been a congenital condition, something there from birth. The player could have suffered cardiac arrest anywhere, but it didn't happen just anywhere. It happened on a football field. So what does football, if anything, have to do with it? Football, like any strenuous sport, puts extra stress on the heart. As our muscles work harder, the heart must pump harder to get more oxygen out to them. If the heart is already in some way weakened by some pre-existing condition, the extra stress can cause a kind of electrical short circuit, sending the heartbeat out of rhythm. This can cause the heart to stop. Football doesn't cause the problem, but the stress it places on the heart can help to trigger an event.
It is important to protect from sudden cardiac arrest by doing what we normally do with anyone, a good history that includes family history, particularly if there's a history of a sudden cardiac arrest in the family, any symptoms that may have been missed, and then a good physical examination, listening to the heart, listening for murmurs or other sounds that are abnormal. An electrocardiogram can also pinpoint some problems, and if any of those are doubtful, then an ultrasound of the heart, which we call an echocardiogram, can be incredibly helpful.
Which is why FIFA recommends that all players get screened for existing cardiovascular conditions. To do this, FIFA has developed a heart safety protocol as part of their pre-competition medical assessment. It involves taking personal and family medical histories, blood tests to assess a variety of heart risks, a 12-lead electrocardiogram, more commonly known as an EKG or ECG. That will check for any electrical irregularities in the heartbeat, and an ultrasound scan of the heart, known as an echocardiogram, which allows a specialist to see the heart's structure in real time and motion.
I think taken all together, these tests can really help pinpoint if there's a problem. Certainly a good history again and a good physical examination. The electrocardiogram can look for electrical abnormalities. And finally, an echocardiogram can give a good picture of what the heart looks like. If there's a problem with the heart muscle, if there's a problem with the valves, the ultrasound can be a very, very valuable tool.
Still, when emergencies do arise, preparation is key, because after a player collapses, there's a very short window of time in which to respond. And the most effective response is defibrillation, the administering of a small electric shock to the heart by a device known as a defibrillator. This shock can get the heart pumping again in a normal rhythm.
A sudden cardiac arrest is definitely a race against time. Applying resuscitation, cardiopulmonary resuscitation, is so important because the brain starts to get damaged within 6 to 9 minutes after it's losing oxygen. If a defibrillator is going to be used, loss of every minute drops the chances of survival by 10%.
It can be critical to have an AED, an automated external defibrillator, on site. It comes with instructions anyone can follow. You don't have to be a doctor to figure it out. And let's not forget CPR. CPR, or cardiopulmonary resuscitation, combines repetitive pressing on the victim's chest with exhaling into his or her mouth. More emphasis today, however, is placed on the chest compressions. The idea is to pump the blood manually to deliver oxygen to the brain. CPR alone may not restart a stopped heart, but it can buy precious minutes until an emergency team arrives or a defibrillator can be located. The point is to be prepared, because while sudden cardiac arrest in football is rare, it can happen. Fortunately, there are precautions players can take. Having appropriate medical tests to discover pre-existing conditions, staying hydrated during the game, even taking oneself out of the game if something really doesn't feel right. Sudden cardiac arrest doesn't strike many football players, but when it does, every minute counts. Thanks for joining us for CONCACAF's Winner's Health. Take care and stay healthy. For more information about sudden cardiac arrest, please visit CONCACAF.com.